You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello. Thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about getting sick during pregnancy and finding safe relief. Getting sick is especially tough when you're pregnant. And unfortunately, during pregnancy, you are more vulnerable to illnesses like colds, the flu, and COVID-19. This episode will help you understand what kind of illness you may have, how to safely treat your symptoms, and when to reach out to your doctor or midwife. You will learn how these viruses spread, what symptoms to watch out for, and how to distinguish between the common cold, pregnancy rhinitis, strep throat, the flu, and COVID-19. Find out about the evidence-based, non-medical strategies to ease symptoms. Plus, you will hear about the research on homeopathic remedies like Umcka and herbal teas, plus a review of the safety of over-the-counter medicines and cold medicine ingredients like acetaminophen, antihistamines, decongestants, and cough suppressants. You can find the full article and all of the links and resources for this episode at pregnancypodcast.com/sick. One of my favorite things about doing this podcast is that I get to do all the heavy lifting and all the research so that you don't have to. Become a Pregnancy Podcast Premium member to access every single episode of the podcast. You will get an ad-free experience, so you'll never hear ads. Plus, when you sign up, you get a free copy of the Your Birth Plan book. Let me save you the time and hassle of digging through the research and sifting through conflicting information. No matter what you're looking for more information on, there's a Pregnancy Podcast episode with all of the answers you're looking for. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. As the #1 baby monitor brand in North America, VTech is trusted by millions of families to deliver crystal clear HD video, reliable performance, strong night vision, and convenient smartphone access. The VTech VM901 baby monitor makes monitoring effortless whether you are home or away. With a 1080 HD camera and a 5-inch parent unit, it's designed for convenience and reliable performance. Check out the VTech VM901 baby monitor at pregnancypodcast.com/VM901 and save 20% with the code VTPodcast20. Wink Stories for Better Bedtimes is a podcast with a collection of bedtime stories designed to help your little one relax and create calming, mindful moments of connection. There are no ads, no interruptions, and each episode is just 15 minutes or less. It's time to discover a better bedtime. Subscribe to Wink Stories for Better Bedtimes wherever you listen to podcasts. 8 Sheep Organics makes amazing 100% clean, natural pregnancy products. From skincare to treating common pregnancy symptoms like stretch marks with clinically proven ingredients, 8 Sheep Organics has you covered. Every product comes with a 100-day happiness guarantee. Try it risk-free, and if you are not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. Your immune system protects you from viruses, bacteria, and other pathogens. The traditional view was that during pregnancy, your immune system is suppressed. But newer research shows that there's a little more complexity to it. Instead of actually being suppressed, it shifts. Some parts are dialed down, others are dialed up, and it all works to safeguard both you and your baby. The placenta also plays a vital role in this process. It helps regulate immune responses, sends antibodies to your baby, and can recognize pathogens and signal your immune system. Plus, hormones like estrogen, progesterone, and HCG also influence how your immune system functions during pregnancy. All of these changes are necessary, but they can leave you more vulnerable to illness or make you feel sicker than usual. Your body is working incredibly hard, and your resources are focused on growing your baby. And your immune system, in the meantime, has to balance the need to protect you while also tolerating your baby. There is an episode on supporting and boosting your immune system during pregnancy. I will link to that episode in the article for this one. Today's episode, we're going to focus on what happens when you do get sick, how you can safely manage symptoms, and which treatments to consider or avoid. The common cold, the flu, COVID-19 are all caused by viruses. There are more than 200 types of viruses that can cause the common cold, with about 1/3 being rhinoviruses. Influenza, of course, is the virus that causes the flu, and coronaviruses can cause respiratory infections, including the common cold and COVID-19. Symptoms of these illnesses often overlap, and they can include a runny or stuffy nose, coughing, sneezing, sore throat, fatigue, fever, and just generally feeling unwell. Cold symptoms tend to be mild, but the flu and COVID-19 usually come on more quickly than a cold and are more likely to cause a fever. COVID-19 can be more severe than the flu, and any of these infections can lead to complications. You can sometimes tell the difference between a cold and the flu by how quickly symptoms start. The flu tends to hit hard and fast, while a cold generally develops more gradually. Distinguishing these from COVID-19 is much more difficult if you're just looking at symptoms. The only way to know for sure would be to get diagnostic testing for influenza and SARS-CoV-2, which causes COVID-19. If those tests are negative, then your symptoms are more likely to be caused by a common cold virus. How do you get these viruses in the first place? These spread when you breathe in particles in the air or touch a contaminated surface and then touch your face. When somebody who is infected coughs or sneezes, they can release hundreds of thousands of tiny droplets into the air. And a person can carry and spread a virus even if they don't show any symptoms. A lot of factors like temperature, humidity, and airflow can all influence how long viruses remain in an environment. The good news is that you can lower your risk of illness by doing a few simple things. One is to avoid contact with anyone who is showing symptoms. That includes being in the same enclosed space. And the same goes for you. If you are sick, isolating yourself and avoiding contact with others can help stop the spread of illness. Enclosed rooms with poor airflow increase your risk of exposure to airborne particles. Outdoor areas or well-ventilated spaces that have air filtration or open windows are much safer. If you touch surfaces, especially if you're in public or crowded areas, you can pick up the virus on your hands. One of the easiest and most effective ways to prevent illness is to wash your hands often and avoid touching your face. After you touch a contaminated surface, a virus still has to enter your body through your nose, mouth, or eyes to actually cause an infection. So the goal is to wash your hands with soap and water for at least 20 seconds. If you do not have access to a sink, you could use an alcohol-based hand sanitizer. There are vaccines for some of these illnesses. When you're exposed to a virus, your immune system can develop antibodies and memory cells that help protect you the next time that you encounter it. With colds and the flu, though, this is a little bit complicated because there are so many different viruses that can cause similar symptoms, and they continue to evolve. There is no vaccine for the common cold, but there is a seasonal flu vaccine that's updated each season to target the strains that are most expected to circulate. Professional organizations like the American College of Obstetricians and Gynecologists recommends that pregnant women get an inactivated or recombinant flu vaccine during flu season because influenza infection can be more severe during pregnancy and can affect both you and your baby. If you would like more information on the flu vaccine, there is a very in-depth examination of the risks and benefits of that during pregnancy, and I will link to that episode. There are also vaccines for COVID-19. In May of 2025, federal health authorities updated their guidance and no longer recommend COVID-19 vaccines for healthy children and pregnant individuals. Instead, they emphasize an individual-based or shared decision-making approach with you and your care provider. Despite that, many professional medical organizations, including ACOG, still recommend the COVID-19 vaccine during pregnancy. And of course, there is a full episode that digs deep into the research on the risks and benefits of the COVID-19 vaccine during pregnancy. Let's talk about actually treating cold, flu, COVID-19 symptoms. Patients that have a cold without complications are typically not prescribed medication. There are some prescription antiviral drugs that can be used to treat the flu. There are also prescription treatments for COVID-19. If you have symptoms and you want to consider these, please get in touch with your doctor or midwife. They can monitor how you're feeling and give you the most up-to-date recommendations. Plus, your doctor, your midwife, they know the particulars of your pregnancy, and they're going to be on top of any conditions that could put you at a higher risk. If at any time you have symptoms that are concerning, please talk to your doctor or midwife. They can discuss treatment options and over-the-counter medications. If you and your care provider are comfortable managing symptoms at home, there's plenty of information available on what's safe and effective during pregnancy, and we're going to cover that in this episode. First, we're going to cover non-pharmacological options, and then we'll talk medications. There are many non-pharmacological remedies to help you find some relief from cold and flu symptoms. And many expecting parents start with these methods before resorting to medications. First, anything you can do to keep your immune system functioning well will help you stay healthy and give your body a better chance to fight off a virus. This starts with very basic things. You want to eat healthy whole foods. You want to stay well hydrated. You should get most of your nutrients directly from your diet, not from a supplement. And a high-quality prenatal vitamin can help fill in gaps and ensure that you and your baby are getting all of the necessary nutrients. If you are sick, you may consider taking vitamin C or zinc. A review found that zinc, when it's taken within 24 hours of symptom onset, that this was in a syrup or a lozenge form, can reduce the duration and severity of colds. There is also evidence that vitamin C supplementation may lower the risk of catching a cold for specific groups, and other studies show that vitamin C may shorten the length or decrease the severity of symptoms. Citrus fruits are a very easy source of vitamin C, and foods high in zinc include meats, shellfish, and legumes. Viruses can also cause dehydration, especially if you have a fever, so you will need extra fluids when you're sick. Water, of course, is always the best choice, but other things like broths, teas, and juices can also help keep you hydrated. You may also want to consider electrolytes if you're losing a lot of fluid or you're having trouble staying hydrated. Let's talk symptoms. One symptom that can easily be confused with a cold is pregnancy rhinitis. The main symptoms are sneezing, nasal congestion, runny nose. If you're dealing with these issues and you don't have a fever, a cough, or any other signs of illness, it may be pregnancy rhinitis. Symptoms tend to increase as your pregnancy progresses, and this is most common in the third trimester. The good news is that this does resolve after your baby's born. If your congestion is due to a cold, a humidifier may help, especially if you live in a very dry climate. A warm shower or bath can also provide relief by adding moisture to the air. When you sleep, you can try elevating your head on extra pillows, or you can use nasal strips to help open your nasal passages and saline nasal drops or sprays to keep them moist. If you have a sore throat, you can try sucking on ice chips if the cold feels soothing. Alternatively, you may want to try drinking warm tea. Other common remedies that are non-pharmacological include gargling with warm salt water, sucking on throat lozenges, or drinking hot water with lemon and honey. One thing I tend to resort to for a sore throat is the throat coat tea from traditional medicinals. But this does contain about 820 milligrams of licorice root. Licorice has a compound called glycyrrhizin, which can influence how your body regulates cortisol. One study showed that children of mothers who ate large amounts of licorice during pregnancy, around 250 grams per week, scored lower on cognitive and memory tests, showed more signs of ADHD, and girls experienced earlier puberty. Other research has linked more than 500 milligrams of glycyrrhizin per week with shorter pregnancies. Black licorice usually has more of this than red licorice, and not all products labeled as licorice actually contain real licorice root. For example, red licorice candy like Twizzlers doesn't actually contain any licorice root at all. So while the throat coat tea is very effective for soothing a sore throat during pregnancy, you should exercise caution because it does contain licorice root. If you have a severe sore throat without other cold symptoms, you could have strep throat. Strep differs from a cold or the flu because it's caused by bacteria, not a virus. But because it's caused by a bacteria, antibiotics will treat it. Your doctor or midwife can test you for strep and prescribe antibiotics if you test positive. Another common symptom when you're sick is fatigue. This is more common with COVID-19 or the flu than with the common cold, but all viruses can leave you feeling exhausted. The best thing that you can do when you're sick is to rest and get extra sleep. Your sleep and your immune function are very closely connected. And when your immune system is activated, it can alter your sleep needs. Your body works extra hard to fight off an infection, and rest is one of the best ways to recover quickly. I completely understand that taking sick days from work can be difficult when you're trying to save all your time off for maternity leave. Plus, if you have another child at home, you can't call in sick because you're a mom and there are no sick days when you're a parent. If you can take a day off from work to rest, please do that. It will help you recover faster. And sometimes spending a little more time up front can save you many more days of dealing with being sick later. Another common symptom that can pop up when you're sick is a fever. This is part of your body's immune response as a natural defense against infections. And this is more common with the flu and COVID-19 than with a cold. The CDC and ACOG define a fever as a body temperature of over 100.4 degrees Fahrenheit or 38 degrees Celsius. There are concerns about fevers during pregnancy. A review and meta-analysis that included 46 studies found maternal fever was associated with neural tube defects, oral clefts, and congenital heart defects. There were some conflicting results among the studies on whether you should use a medication to reduce a fever. There's still so much that we do not know about how fevers can affect a baby in utero. And there's no universal guidelines on what temperature or what length of a fever could be harmful, or exactly what impact a fever could have. Keep in mind, there is a significant difference between running a fever of 100.4 for a couple hours and running a fever of 103 degrees for a day or longer. Antipyretics are medications that are frequently used to reduce a fever, and we will talk about those later in this episode. If you do get a fever, you need to focus on staying well hydrated and keeping your body from overheating. You should be drinking plenty of fluids and use simple cooling measures, like placing a cool, damp washcloth on your forehead, taking a tepid bath or shower, and wearing light clothing, and even if you feel cold, not bundling up under a ton of blankets. So we've covered the main symptoms and some non-pharmacological options. After those, some people turn to homeopathy and herbal remedies for additional relief. Homeopathy dates back to the late 18th century. This is based on the idea that disease symptoms can be treated with very small doses of substances that, when given in larger amounts, would cause similar symptoms in healthy people. Many homeopathic products are diluted to such an extent that they no longer contain detectable levels of the original substance. There is some disagreement on the effectiveness of homeopathic remedies. The FTC doesn't stop homeopathic companies from selling products, but it does regulate how they market their products. According to the FTC, claims about homeopathic products are not based on modern scientific methods and are not supported by current medical experts. But homeopathy still has many supporters. Manufacturers are required to have evidence that their products are effective, and if they lack such evidence, the label must include a disclaimer stating there is no scientific evidence that this product works, and the product's claims are based only on theories of homeopathy from the 1700s that are not accepted by most modern medical experts. Despite these disclaimers required by the FTC, many people feel that homeopathic remedies are helpful, even if there is not strong scientific evidence. If you choose to use any kind of homeopathic remedy, please disclose it to your doctor or midwife just as you would any other over-the-counter or prescription medication. One popular homeopathic remedy to treat cough, sore throat, congestion, and other respiratory ailments is Pelargonium pseudoides. This is a medicinal plant native to South America. A common brand name of this herb is Umcka. You may also see it as Zucol or Caloba. This is something that you can get in tablet or liquid form. Several studies have examined Umcka, including a meta-analysis of 10 clinical trials that generally showed positive results. Most of the research focused on acute bronchitis or respiratory infections. Based on limited evidence from a small number of trials, the conclusion was that this may help relieve symptoms in acute bronchitis, rhinosinusitis, and the common cold. However, the clinical significance of these effects remains unclear. All of the studies in this meta-analysis were sponsored by a manufacturer of Umcka and conducted within the same region. Overall, the quality of these studies was considered low. Reported side effects included gastrointestinal issues like nausea, vomiting, diarrhea, or heartburn, as well as allergic skin reactions like itching and hives. Unfortunately, pregnancy was a criteria for excluding participants in all of the studies, so we don't have research specifically for Umcka during pregnancy. Now that we have covered homeopathic remedies, let's talk over-the-counter medications. Cold medicines can contain many active ingredients, things like acetaminophen, cough expectorants, cough suppressants, antihistamines, and decongestants. The recommendation for any over-the-counter drug is to see your doctor, and nearly any label will state something to the effect of, if you are pregnant or breastfeeding, ask a health professional before use. Let's walk through each of the major category of cold medicine ingredients, and we'll look at the research on these to understand their safety better. First are analgesics. These are pain relievers, and they include NSAIDs, which stands for non-steroidal anti-inflammatory drugs, and acetaminophen. These are also antipyretics, which means that they reduce fever. Analgesics treat minor aches and pains, reduce fever, or can be in combination medicines to treat colds or other symptoms. So let's look at the main types of these. First is NSAIDs. This includes aspirin and ibuprofen. Both are pain relievers, anti-inflammatory agents, meaning that they reduce swelling and inflammation, and they are antipyretics, so they reduce fever. Doctors generally advise against aspirin during pregnancy as a pain reliever or fever reducer. The risks of taking aspirin vary depending on the stage of pregnancy. In the first trimester, it poses a concern for pregnancy loss and congenital disabilities. In the third trimester, the risk of the premature closure of a vessel in the fetus's heart increases. Use of high-dose aspirin for long periods in pregnancy also increases the risk of bleeding in the brain of premature infants. One thing that does set aspirin apart from other NSAIDs is it has an antiplatelet effect, which reduces blood clotting. There is some evidence that low-dose aspirin may reduce the risk of preeclampsia. The American College of Obstetricians and Gynecologists does support the use of low-dose aspirin for the purpose of preventing preeclampsia in those with risk factors, but that is something that you would only take if prescribed by your doctor or midwife. So aspirin, not a great option for an NSAID during pregnancy. You also have ibuprofen, and that is also usually not recommended when you're pregnant. There is evidence that ibuprofen can increase your risk for miscarriage early in your pregnancy, and the FDA recommends that pregnant mothers avoid it after 20 weeks, so in the second half of your pregnancy, because it can result in low amniotic fluid. Next, we're going to cover acetaminophen and other ingredients in cold medicines like cough suppressants, expectorants, antihistamines, decongestants. Before we do that, I would like to thank the sponsors that have supported this episode. Many companies offer exclusive discounts for pregnancy podcast listeners, and you can always find discounts and promo codes at pregnancypodcast.com/resources. VTech offers a wide range of baby monitors, and they're the #1 baby monitor brand in North America. They're trusted by millions of families to deliver crystal clear HD video, reliable performance, strong night vision, and convenient smartphone access. The VTech VM901 baby monitor makes monitoring effortless, whether you're at home or away. There's a 1080 pixel HD camera and a 5-inch parent unit. You get free access to the My VTech app with no subscription or fees required. You can remotely pan, tilt, or zoom. There's a wide-angle lens, infrared night vision, two-way talk, plus built-in soothing sounds and lullabies, temperature alerts, split-screen support if you have multiple cameras, and plug-and-play setup with secure encrypted Wi-Fi. The VM901 baby monitor is designed for convenience and reliable performance. Check out the VTech VM901 baby monitor at pregnancypodcast.com/VM901 and save 20% with the code VTPodcast20. As you are preparing to welcome a new baby, you may have already imagined what bedtime will look like with your growing family. Some nights will be calm and cozy, and some nights not so much. If you want to make bedtime easier and add a little magic to the end of the day, there's a podcast that you are going to love called Wink Stories for Better Bedtimes. Wink is a collection of bedtime stories that are designed to help your little one relax and create calming, mindful moments of connection at bedtime for you and your child. There are no advertisements, no interruptions, and each episode is just 15 minutes or less. These stories are sensory aware, which means that they help calm restless bodies and encourage interaction between you and your little one. I've been listening to Wink bedtime stories with my kids. These stories are genuinely fun. Think friendly monsters, funny animals, and little adventures to listen to together. It's time to discover a better bedtime. Subscribe to Wink Stories for Better Bedtimes wherever you listen to podcasts. Let's get back to today's episode. Due to the risks that are associated with aspirin and ibuprofen, acetaminophen has been the primary recommendation for a pain reliever or a fever reducer during pregnancy. As a result, up to 65% of pregnant mothers report using acetaminophen at least once during their pregnancy. You may know acetaminophen by the brand names paracetamol or Tylenol. There are more than 600 over-the-counter medications that include this drug as an active ingredient, including many cold medicines. There has been growing attention on possible links between acetaminophen use in pregnancy and neurodevelopmental outcomes like autism spectrum disorder. This was covered in depth in a separate episode. I will link to that if you would like to really get into the weeds. But to bring you up to speed, here's what you need to know. A review of 9 separate studies found that acetaminophen use during pregnancy is associated with adverse neurodevelopment, including ADHD, autism spectrum disorder, and lower IQ. In one study, researchers related an increased risk for asthma in children that had exposure to acetaminophen during pregnancy. Another study found an association between acetaminophen during pregnancy and behavioral problems in children. The FDA states clinicians should consider minimizing the use of acetaminophen during pregnancy for routine low-grade fevers. This consideration should also be balanced with the fact that acetaminophen is the safest over-the-counter alternative in pregnancy among all analgesics and antipyretics. Aspirin and ibuprofen have well-documented adverse impacts on the fetus. ACOG's position is that acetaminophen is one of the few options available to pregnant patients to treat pain and fever, which can be harmful to pregnant women when left untreated. Maternal fever, headaches as an early sign of preeclampsia, and pain are all managed with therapeutic use of acetaminophen, making it essential to the people who need it. The conditions that people use acetaminophen to treat during pregnancy are far more dangerous than any theoretical risks and can create severe morbidity and mortality for the pregnant person and the fetus. So you can see there are some differences in the opinions from the FDA and ACOG. Based on the research that we have, there are valid concerns about acetaminophen use and autism. Remember, though, autism is a spectrum disorder. So this is unlikely caused by a single factor. It's much more likely resulting from many environmental and genetic influences. The research available on acetaminophen use during pregnancy does not demonstrate a direct causal relationship. And hopefully we will see more research that gives us much more information in the future. In the meantime, with what we have, there is some disagreement between government health organizations and physician groups. And because of that mixed messaging, care providers may also differ on their opinions on the safety of acetaminophen during pregnancy. Some doctors may be more cautious about their pregnant patients taking this. Some may restrict the use to longer lasting or higher fevers rather than just short-term low-grade fevers or for minor aches and pains. If you get sick and you are considering a medication and you don't have a fever or you don't have severe pain, you may consider taking a medication that does not contain acetaminophen. And if you have any questions about the safety of acetaminophen during pregnancy, please talk to your doctor or midwife. Next, let's talk about cough expectorants and suppressants. Coughing is your body's way of removing irritants and secretions from your respiratory system. And cough remedies usually fall into one of two groups: expectorants and suppressants. Expectorants, which are also known as mucolytics, thin mucus so that it's easier to cough up phlegm from your lungs. The most common active ingredient of a mucolytic or an expectorant is guaifenesin, and this is found in medications like Mucinex. Cough suppressants or antitussives work in a different way. They actually block the cough reflex. The most common over-the-counter suppressant is dextromethorphan. This is often listed as DM after a brand name like Robitussin DM. Suppressants can be helpful if you have a persistent cough that's keeping you awake at night, but remember that coughing is a natural way for your body to clear mucus. So if you are bringing up a lot of phlegm, an expectorant might be more suitable than a suppressant. There are some prescription cough syrups that contain codeine. This is an opioid, and it's generally not recommended during pregnancy. Unfortunately, ACOG does not have specific guidelines for cough medicines. Many sources cite that both dextromethorphan and guaifenesin are generally safe during pregnancy. There is a study that found possible associations between using these in the first trimester and increased risks of some birth defects, but we really need more research. Recommendations for cough medications may vary by provider, and some may suggest that you avoid these in the first trimester. Another common ingredient in cold medicines is antihistamines. These are most commonly found in allergy medications, but because they help alleviate congestion, runny nose, and sneezing, may also be included in cold medicines. ACOG does have specific guidelines for using antihistamines to treat allergies, but not specifically for cold medicines. While antihistamines are frequently included in combination cold medicines, they're not a miracle drug for colds. A Cochrane review looked at 18 studies with over 4,300 participants, and they found that antihistamines tended to help during the first day or two of a cold, but had no significant effect after that. Unfortunately, this review did not include any studies on pregnant mothers. When you start digging into the safety of antihistamines, there are so many different types. And if you're trying to understand each one that's included in various medications, it gets very confusing very quickly. If you are considering a cold medicine that does contain an antihistamine, please consult with your doctor or midwife first. The last ingredient that I want to cover is decongestants. These constrict your blood vessels, which can relieve congestion and a stuffy nose. The most common decongestants are pseudoephedrine and phenylephrine. Both of these are found in medicines like Sudafed. According to ACOG, pseudoephedrine has been linked to a small risk of abdominal wall birth defects and is not recommended during the first 3 months of pregnancy. A study showed a slight increase in the risk of an endocardial cushion defect. This is a type of heart defect with the use of phenylephrine. To put small into perspective here, endocardial cushion defects occur in about 0.34 of every 1,000 live births. And even if phenylephrine exposure increased the risk 8-fold, the absolute risk of having a child with this defect would be roughly 2.7 per 1,000 live births. Just to help put those statistics into perspective and give you an idea of what slight increase actually means. Overall, there is still a lot that we do not know about decongestant use during pregnancy and potential risks. I know I've covered quite a bit of information so far. Let's kind of summarize what you should know about cold medicines. The safest option is to skip cold medicine altogether. That removes any potential risk to you or your baby. And some expecting parents prefer this approach, especially during the first trimester when development is most sensitive. Of course, the trade-off is that cold medicine helps you feel better while your body is fighting off an illness. If you do decide to take a medication, you want to aim for the lowest effective dose for the shortest possible time. You should try and choose a medicine that targets only the specific symptoms that you have, which means that you should avoid extra strength or combination products that include active ingredients that you may not need. Depending on your symptoms and how you feel, you may decide that rest, fluids, and comfort measures are enough to deal with your cold symptoms. But if your symptoms are significant and you feel like you need a medication, of course, you should check with your doctor or midwife first. One last note about purchasing medications. When you're buying anything over the counter, you will often see a brand name and a generic version. With cold medicines, brand names are Dayquil, Theraflu, Mucinex, and then you'll have generic versions of these medications that are very similar. In theory, if the active ingredients and the doses are the same, the medications should work the same way. But in practice, there have been concerns about quality control and even fraud in some areas of generic drug manufacturing. I listened to a really great podcast episode of the Drive podcast with Dr. Peter Attia. This was an in-depth investigation with journalist Catherine Eben. They highlighted issues with how some generic drugs are produced and tested. This was really an eye-opening conversation for me to listen to. I will link to it if you're interested. This podcast episode really compelled me to spend a little bit more money to purchase only brand name medications. That's my personal preference after learning about some of the issues in the generic drug industry. And like I said, if you would like to hear that episode on the Drive podcast, I will link to it. While we've covered a lot about medications during pregnancy, once your baby's born, you still need to be careful about medication. And that's because many drugs can pass into breast milk. Fortunately, there is an excellent resource with information on the safety of medications during breastfeeding. LactMed is a comprehensive database where you can look up a drug, you can do this by its generic or brand name, and find out how much of the medication enters breast milk, possible effects on a nursing baby, and if there's any effects on your milk supply. This also will list alternative medications that might be safer while breastfeeding. LactMed is a really fantastic resource, and while this is a great starting point, you should, of course, continue to consult your doctor, your midwife, or your pediatrician before you take any medications while breastfeeding. I'm sure that I've given you a lot to think about in this episode. When it comes to over-the-counter cold medicines in pregnancy, there are rarely perfect answers. There are just not large, long-term, double-blind, placebo-controlled trials proving that these medications are 100% safe for pregnant moms and babies. Most of the time, we're working with limited data, older studies, or we're trying to piece together information on individual ingredients rather than on every possible combination product. You should absolutely talk with your care provider before you take any medication, even if it is available over the counter. Your doctor or midwife can examine your specific situation. They're taking into account your medical history, other medications you may be taking, allergies, how far along you are in your pregnancy. And then the two of you together can decide when it makes sense to use medication and which options are safest. In the end, this is really a risk-benefit decision. On one side is the potential risk of exposing your baby to a medication, but on the other hand, there's the benefit of relieving symptoms like fever, severe congestion, lack of sleep, all of which can also affect your health. A practical approach would be to start with non-medication strategies first, and then if you opt to take a medicine, you should choose single ingredient products over multi-symptom formulas when possible, and use the lowest effective dose and limit how long you take it. There's really no one right answer for every pregnant mother. And after listening to this episode, you have a lot more information to have an educated conversation with your doctor or midwife and to make an informed choice that you feel confident about. Regardless of what you choose to do with medication, when you're sick, the most important thing that you can do is rest. Your body is already working incredibly hard to grow your baby, and it needs extra energy to fight off an illness. If possible, ask friends or family to help so that you can slow down. That could mean having someone drop off a meal, pick up groceries, or maybe come over and walk your dog. If you have a partner present, please lean on them. Let them know what feels most supportive when you're sick. You may want extra attention and comfort, or you may feel better with some space and some peace and quiet. Share what you need so that your partner can help you protect your rest. The more that you can step back from daily tasks and responsibilities and truly rest, the sooner your body can recover. While we do talk about a lot of research and evidence, this podcast is not intended as medical advice. My goal is always to provide you with information and tools so that you can have better conversations with your care team and make informed decisions. If at any point you are concerned about your symptoms or how you are feeling, please call your doctor or midwife. Some specific reasons to call right away include a high fever that does not improve after 24 hours, symptoms that persist or worsen, if you're coughing up yellow or green mucus, or if you have any chest pain or trouble breathing. When in doubt, it's always best to check in. I know I have mentioned this numerous times throughout this episode. Please talk with your doctor or midwife about any medications that you're considering, including over-the-counter drugs, homeopathic products, and any supplements so that you can be confident that what you're taking is safe for you and your baby. To recap today's episode, we talked about getting sick during pregnancy and finding safe relief. I touched on how your immune system changes during pregnancy. We talked about the common cold, the flu, and COVID-19. I touched on the vaccines that are available for the flu and COVID-19. And then we talked about treating symptoms. I went through treating congestion and runny nose, a sore throat, fatigue, a fever. I covered homeopathy and remedies like Umcka, and then got into the evidence and research on medications. I talked about analgesics, which includes NSAIDs like aspirin and ibuprofen, then discussed acetaminophen, as well as a lot of research that is bringing this under scrutiny for its use during pregnancy. I covered cough expectorants and suppressants, antihistamines, and decongestants. Then we wrapped up this episode kind of summarizing the guidelines on cold medicines, that you should be taking the lowest effective dose for the shortest possible time, and that ideally you're avoiding extra strength or multi-symptom formulas that treat symptoms that you do not have. And lastly, we talked about weighing the risks and benefits of over-the-counter medications, prioritizing rest, and when to contact your doctor or midwife. I would like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Please share this episode if you have a friend who's pregnant. So many listeners discover the podcast through recommendations, and I always appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/sick. If you're looking for more evidence-based information, become a Pregnancy Podcast Premium member. You will get an ad-free experience, so you'll never hear advertisements. Plus, you get access to every single episode. That includes hundreds of episodes exclusively available to Pregnancy Podcast Premium members with information that you will not find anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.